The physicians emphasized the importance of understanding the colonial narrative and its impacts on the health of Aboriginal peoples.
First and foremost, I'm a physician. I'm a physician who has had a wide array of different experiences, both within the healthcare system, but also out in community. To me, my real passion as a physician is looking at health equity through the lens of a complex system. When I arrived in British Columbia, that changed completely. It was really obvious that there was something different in British Columbia. The way Aboriginal people or Indigenous people interacted with society was different. So I was really pleasantly surprised to discover a whole side of Indigenous culture that I hadn't been exposed to. And it was very positive. It involved perspectives, it involved art, it involved conversation.
What does Aboriginal cultural safety mean to you as a physician or even as a person?
Physicians, or any clinician for that matter, can commit to Aboriginal cultural safety by doing a few things. First, they can ask a question. The question is, what is your patient's context? To hear that, you need to listen. It's really important that you give people enough time to describe the things that they think are in the way of them achieving health and wellness. And by listening, you get to understand their story. You learn a little bit more about their social determinants of health. From there, you take that story, that context, and juxtapose it across history. What is it that has impacted that patient's population, that patient's community? In this case, that person's Indigenous background, Indigenous heritage, the fact that they're Aboriginal. What impact do you think that has played on their socioeconomic status, on their social determinants of health? Then, and this is a part that I think is often left out, is you need to do something. So you actually need to pick one of those areas that you feel, or that your patient feels, is the most impacted by their identity, by their context, and work on it. Commit to doing something to address any disparity that exists. Hi, I'm Dr. Trevor Corneil, Vice President of Population Health and Chief Medical Health Officer. I am committed to advancing cultural safety for Aboriginal people in interior health.